everybody, this is Leila, Health Education Manager here at AI Arthritis, and I am here to debrief day 2 of ACR 2024, or Sunday. So yesterday was Sunday. I'm recording this Monday morning because yesterday I had a bad day. I was very tired. And so I ended up going to one session, but I also ended up being able to read some abstracts and go to some of the abstract sessions. The abstract sessions are a long session in person. They're about an hour and a half, and they have little 15-minute segments of different abstracts that are under each different category that they have. So I was able to attend some of the weight loss, some of them that had weight loss in it, as well as information about pain. Okay, let me correct myself. It's not about weight loss. It's actually about obesity and how obesity can affect inflammation. And the prevalence of obesity in autoimmune diseases it's pretty significant. So in RA, they say about 14% patients are obese. In lupus, it's about 14%, and in psoriatic arthritis, it's about 20%. And so in psoriatic arthritis, they exhibit higher odds of developing. So obese individuals are more likely to develop psoriatic arthritis. And so that was a very interesting thing to learn. I had never heard anything like that before in terms of how likely you are to develop an autoimmune disease if you are obese. And I have been obese my whole life. I actually had weight loss surgery last year, the vertical sleeve gastrectomy, in order to help with my obesity. And even though I got weight loss surgery and did lose a good amount of weight, I'm still considered obese, and I will still be considered obese probably my whole life because of my BMI. And so it's very interesting to learn how obesity can affect these autoimmune diseases. And from this abstract, that's really what I learned was the prevalence of obesity in the autoimmune diseases that they studied. And they do have recommendations and actionable tips in order to help with obesity, discussing your weight with your providers, incorporating a balanced diet and exercise, things that we all know about and do try to incorporate in our lifestyle, although it doesn't account for the recommendations that they give don't account for the symptoms that we may be experiencing and that may prevent us from, exercising on a daily basis or as much as we'd like to, or the motivation for us to be able to exercise and be able to cook for ourselves healthy food and things like that. Yeah, hopefully because they know this now that these patients are more likely to have these autoimmune diseases and have obesity, then maybe there will be a next step afterwards on tailoring specific programs for obesity for those who have autoimmune disease. For me, my autoimmune disease or my lupus was not considered in any of my weight loss programs. I technically look like a unsuccessful weight loss surgery patient because of the outcomes that came from my surgery. It wasn't enough of my body weight to be considered successful in the amount of time that they deem. But also what we need to know is that in order for your body to lose weight, you have to be healthy. In order to be able to lose the weight, your body has to feel like it's in an equilibrium, in homeostasis of being at a good place, like your immune system is not super overactive and there's not infections going on and things like that. Because in the beginning, after I got my weight loss surgery, I had a bunch of UTIs, and those UTIs I felt kept me from losing as much weight as I should have in the beginning because my body just was freaking out. I just had this surgery and I'm having an infection. It's trying to, balance out and figure out what's wrong before it is allowing you to shed the weight. And so that's just one thing, is that in order to even be able to change anything about weight, appearance, anything like that, you have to be healthier overall in order to even have your body allow you to do that. So of course, no matter what, even if it's not to lose weight, exercise is always so good to help with the joints, to help with movement and just overall wellness. But in order to really lose weight and lose weight hardcore, you have to be healthy. And so I just want to say that with obesity and with weight loss and how much in America we do try to push weight loss, and there's a lot of that conversation going on now. Just remember that your body is fighting its own fight, and it can be a lot harder for us to lose the weight. So I just wanted to make sure to give that validation to everybody, because I know that weight is something that a lot of people with our conditions struggle with. Another one of the abstracts that I went to was about chronic pain. And it was about pain disability reduction. So participants who who completed this study, they reported a significant decrease in pain-related disability, and that's amazing. Pain can debilitate a lot of us in a lot of ways. And so this was mainly for older adults, and they practiced a self-management program and provided tools and strategies to help manage chronic pain. The program, it offered varying benefits on individual factors such as age and socioeconomic status. So they tried to do their best to meet the patients where they were and what they could accommodate for. And so I actually pulled up this program is from Stanford, and it's called the Chronic Pain Self-Management Program. And these are the different tips that they have developed after going through this program with this first set of cohort. And so these are the tips. 1, determine how you spend your time. Keep a diary of how long it takes you to do activities and how long you need to rest for in order to recover. 2, make a schedule. Develop an activity schedule that includes rest breaks and stick to your schedule. 3, be time-oriented, not pain-oriented. Knowing how long you can do an activity before your pain gets worse means you can schedule specific activities for a certain number of minutes before taking rest for a specified period of time. And this keeps you not in pain, but in control. Rest before your pain starts to get worse, because so many times we want to complete activities and push through pain to keep a schedule, but stop and make sure to take a rest. I needed to learn that yesterday when I was not feeling well after pushing myself so hard the past week to prepare for the conference. 5, incorporate change into your activity routine. A change may be just as good as rest. If you're in a situation where you can't take a rest break, alternative activities frequently, changing body position, stretching, or going for a walk. Use a timer to signal breaks. Me and Deb were just talking to Tiffany about this morning, that we try to set timers for activities that we're doing, so that in case 1, we need to keep time, or 2, if you know that you can only do that activity for a certain amount of time before you lose focus or before you start to be in pain. That's really important to keep yourself going. 7, break tasks into smaller, more manageable pieces. 8, avoid rushing. Slow down, plan ahead, and because rushing can increase your stress, which therefore can increase inflammation and pain. So it's a really unfortunate phenomenon and conundrum that happens. 9, don't overschedule activities. Work on developing realistic expectations for yourself. I still really have to work on that. I always can think that I can do more than I can, and so I end up under delivering of what I would wish I could. So I need to make more realistic expectations for myself and prioritize your activities. Some days you may not be able to get to everything. Determine the most important thing you want to accomplish in that day and then work on that. And yeah, I think that those are some amazing tips to be able to go by. And this is what the chronic pain self-management program was based off of, that they presented in this abstract. And let me actually read the titles of these abstracts so that if you wanted to look back, you could. The chronic pain is called Impact of the Stanford University Chronic Pain Self-Management Education Program on Pain Severity, Pain Self-Efficacy, and Pain Disability in a population with a high prevalence of arthritis. speaking of older individuals. And so let's see. Okay. And then the other one that I spoke of is obesity and the risk of autoimmune diseases, insights from the national inpatient sample. So those are the two abstracts that I wanted to report back on because I thought would be very interesting to our patient population that is watching this. And lastly, I did go to a lupus nephritis care session. It was called Test Your Knowledge. So basically, the whole session was very interesting. It was going through a case study of the patient that the researcher had in real life. And so it was like a spectrum of time and different decisions that were being made in this patient's life and how the treatment that they were receiving was tailored to those different decisions that were being made during that time of life, during diagnosis, or again, it's a spectrum of the patient journey. During diagnosis, your decision making on treatment can be totally different than maybe 3, 4, 5 years down the line. And basically, they went through the different times when they took kidney biopsies to really see how bad the lupus nephritis was in that moment. They talked about the different treatment options that there could be and that there's no wrong answer in what they provided, but just showing that there's a variance in how every single individual rheumatologist would treat specific cases in general. And so there's always going to be different combinations of medications that they think may work well together and things like that. So it was really cool to see how the different rheumatologists in the room would think, because they were asking to raise your hand for which different treatment option you would go with. And the researcher basically said that a strategy on getting very detailed insight on what's actually going on in the body is doing a kidney biopsy. And although kidney biopsies can be very invasive, they are the only way to really know how someone's lupus nephritis is going and at what stage it's in. And she does recommend to do them often or whenever treatment changes are being discussed. And so that was a very interesting session to go to, just to see how all the different rheumatologists differ in their options that they would pick, and also comparing the options that were up there to the shared decisions that I've made with my providers, especially around family planning, on preference, whether you like injections or infusions or pills, or the amount of pills, things like that. It's really amazing to see that there are a lot of different options for the medications out there and the different combinations that you can do. I also saw some information about other sessions that talked about the alternatives to kidney biopsies. And so I do want to report back on that and a little bit more about some of the lupus abstracts, and I will do that for my video for today. And so thank you so much for watching. This is day 2 of Go With Us to ACR 2024. Today is going to be our last day of actually going to the conference. So today, Monday. And I'm excited to report back and give you my feedback from whatever happens today. I have to go and get ready now, but thank you so much for listening to my debrief. And if you have any questions, feel free to email us back about any of these debriefs that we have. You can tag us on social media, message us on social media if you have any questions, or if you are in our Slack elevated experience, you have access to us right there. Alrighty, talk to you all later. Bye.